Hey there, and welcome. If you're getting ready for a hip replacement, or you've just had one, you are on an amazing path to getting your mobility back. Think of this as your personal roadmap, here to guide you step by step through the entire recovery journey. So let's jump right in.
I'm guessing that's a big yes, right? I mean, that's the whole reason for this surgery, to get you back to doing all the things you love, but with a whole lot less pain. So let's talk about how we get you there, safely and smoothly.
It's really helpful to think about recovery not as downtime, but as the next active part of your treatment. It's a journey with clear steps and milestones. And guess what? You're the star player on this team. I just love this way of thinking about it. The surgery, that's like installing some seriously impressive new hardware. But your recovery, all the physical therapy, the careful movements, the healing, that's the software that gets your new joint running at its full potential.
Okay, so let's start right at the very beginning. Those first few days right after your surgery are all about building a really strong foundation for the rest of your recovery. And the good news is, you'll be in the amazing hands of your hospital care team.
So what's the big takeaway here? It's all about movement. Yeah, it might sound a little crazy, but your team is probably going to have you up and walking, with the walker or crutches, of course, within 24 hours. This is so important for keeping pain under control, getting your circulation going to prevent clots, and just starting to teach your body how to use its new part.
All right, you made it home. You're back in your own space. Now this is where you really step into the driver's seat. These first 6 weeks at home are absolutely crucial for protecting that new hip while it's healing up. Now these golden rules you see here, they are not just suggestions. Seriously, they're all about preventing the new ball of your hip from popping out of the socket. That's called dislocation. So avoiding that 90-degree bend means you got to skip the low couches and probably use a raised toilet seat for a bit. And no twisting means you turn your whole body by moving your feet. It might feel a little awkward at first, but it is single-handedly the most important thing you can do to protect your surgeon's incredible work. So, while you're protecting the joint on the inside, you've also got to take care of the incision on the outside. And the goal here is super simple: prevent infection. Your surgical team is going to give you very specific instructions, but the basics are pretty much the same for everyone. Keep it clean, keep it dry, and definitely no baths or swimming until you get the official all clear.
Okay, now for the exciting part. Once you get past that initial 6-week healing window, the focus really starts to shift. This is where you begin to feel the real benefits and start working your way back to, well, your life.
This is the question on everybody's mind, isn't it? When can I drive my car again? When can I go back to work? When can I finally get back on the golf course? Well, let's take a look at a pretty typical timeline.
And this gives you a really good idea of what to expect. Just remember, this is a general guide. Your surgeon is kind of like your personal coach here, and they'll clear you for each of these things based on how you're doing. But the main thing to see is that by that 3 to 6 month mark, most people are back to enjoying activities they might have had to give up years ago. It's pretty amazing.
Listen, if there is one part of this whole process that you absolutely cannot skip, it's this. Physical therapy isn't just a do it if you feel like it kind of thing. Those exercises you're given are specifically designed to build up the muscles around your new hip, get your range of motion back, and really lock in the best possible long-term result. So please do your exercises. It really is the key.
Now, recovery from this surgery is overwhelmingly successful for most people, but being informed and knowing what to look for is part of the deal. And this isn't about making you worried, it's about empowering you so you can act fast if something doesn't feel right.
And just to be clear, this is not a wait-and-see situation. If you experience any of the things we're about to talk about, you need to call your doctor's office or get medical help right away. So let's just quickly run through what these mean. A fever or weird stuff happening with your wound, that could be a sign of an infection. Pain or swelling down in your calf, that's a classic red flag for a potential blood clot, which is a known risk. And sudden shortness of breath, that could mean a clot has traveled to your lungs. Knowing these signs makes you your own best advocate.
I think this is the perfect mindset. You're going to have good days, and you might have some days that are a little tougher. You might feel a huge leap forward one week and then feel like you've hit a plateau the next. That's okay. That's totally normal. Just be patient with your body, stick to the plan, and don't forget to celebrate all the little wins along the way.
So we're going to leave you with this thought. This surgery isn't just about getting rid of pain. It's about getting a fresh start. It's about taking that long walk in the park, playing with your grandkids on the floor, or even just sleeping soundly through the night. As you go through your recovery, keep that goal front and center. What's that first, wonderful, pain-free thing you're looking forward to doing?